All right, restarting. So thank thank you for doing this and being here. You're a friend of mine from home and living in the desert now, and I wanted to talk to you because you are extremely smart but also passionate, and you know a lot that I do not know. So why don't you give people a background on who you are, what you do?
Yeah. Well, I appreciate you for letting me be your first podcaster. It's
Mm,
really cool. So I am Dr. Ross. I am a naturopathic doctor and functional genetic consultant. So I specifically specialize in environmental medicine. So a lot of mold toxicity, heavy metals, pretty much just helping people remove things from their body so that they can heal. And then I also specialize in genetics. So I evaluate someone's genome and I assess genetic weaknesses that might be leading to dysfunction in a specific pathway. So we have different nutrient transportation, proteins, different things in our body that might be dysfunctional. So I kind of just figure out exactly what might be causing a genetic issue and trying to strengthen that. And try to determine like how I can nutritionally support this person and and without causing a detox reaction, because a lot of times when you detox there can be a lot of horrible Herxheimer reaction, or just when you're dealing with a lot of chronic illness it can definitely set someone off, so it kind of just prevents that from occurring,
hmm
which is great.
Before I ask a detailed question, what got you into like what started
Medicine.
that sort of passionate
Yeah,
interest?
I think there's so many things that occurred throughout my life that kind of led me to this trajectory. Like I honestly, I think about it all the time and I just think there was just so many things. As a kid, I I saw a lot of sickness. I watched a lot of family members suffer, and um I think that changes your perspective when you're really young. I saw how the medical system treated them, and it kind of opened my mind to how the medical system and hospital settings can be slightly depressing and not provide the specific care that people deserve. And I always just thought, like, why is the hospital the only option for chronic illness? Like, why is this the only place where people go when they're extremely, extremely ill?
hmm
And I think when you see a lot of death when you're young and you see a lot of sickness, I definitely think you question life a little bit more, but I question the medical system. And when I myself got sick, so I there's a lot of things that typically occurred. I had ADHD when I was really young. Well, I was diagnosed with ADHD. I think I was just a really creative, energetic child,
hmm
and they just didn't know really what to do with me. I just didn't want to sit
hmm
at a desk. I wanted to look outside the window. I was a curious kid. Like I don't think kids in general should be sitting at a desk 8 hours a day. You only have pretty much like 45 minutes of playtime outside, and I don't think that's enough. And the thing is, like, the school setting is not for every type of child. Like, that's not where
hmm
everyone's going to strive and learn, to be honest. And
hmm
when I got that diagnosis, I was told that I had comprehensive issues, I had a low IQ, that I had a learning disability. So I started being put in a lot of special education courses, and I was pretty much told, you're stupid, you need extra time, you have to be taken out of class to actually absorb and take in that information, which was honestly, I think growing up and thinking that you're stupid, it definitely affects your confidence. I was a shy kid,
hmm
definitely very anxious, and and then they put me on these meds, which was very, very like it led to further nutrient depletion. I was already small child to begin with, very malnourished. I was always the smallest in my class, and I also was not developing correctly, if that makes sense.
hmm
And when I was put on these meds, it just further led to I was just vomiting every day. I was constantly I wasn't eating because it decreases your appetite. It's an
Mhm.
amphetamine. It's pretty much it's like taking a low dose of meth. It's
Mhm.
really horrible. And to me, I believe it affects the way that the brain um matures, specifically in young kids. And so I think my parents started to realize, okay, this isn't really helping her. This is causing more dysfunction. And realize that it's just making me more sick. My parents transitioned to having me drink coffee, and I started doing some homeopathy.
Mhm.
And it didn't really change anything. I was still in special education courses, didn't change anything dietarily. And during that time throughout my life, I didn't start experiencing chronic fatigue and really like autoimmune symptoms until I got to high school and I hit puberty. When I hit
Mhm.
puberty, I think the hormonal changes definitely led to more dysfunction. I experienced extremely painful and heavy cycles. They put me on birth control. I pretty much had all my baby teeth, which was really weird. I had most of my baby teeth in middle school, and I had to get them physically removed when I was in high school.
Mhm.
No, I got them physically removed when I was in eighth grade, and I got like nine teeth pulled, and I had no teeth in eighth grade, which is really interesting. But the thing is, my baby teeth were not being removed when there has been association with inflamed gums and baby teeth not coming out associated with hypothyroidism, which is when your thyroid is dysfunctional, which is
Mhm.
something that stimulates growth and activates your metabolism. So it's really, really crucial. And so I definitely had a lot of dysfunction as a kid, and I was definitely sick. And it wasn't until I got to high school and I was starting to see specialists, and the specialists were like, here's another med. And I started questioning them. And I don't know,
Mhm.
like, why. I was also a curious person. I was a curious child. I just wanted to know why I was put on this medication. I wanted to know more about my conditions. I just wanted to know why I was experiencing these symptoms, and they literally could not tell me why.
Mhm.
And I was like, am I gonna have to be on these meds for the rest of my life? And they're like, yeah, pretty much. So I started to do my own research. I started to look into diet. I started looking into nutrition. And I also started weightlifting. And I think that really mm, changed the way I looked at my body. In that process, I also witnessed my mom. She had a heart attack at 46.
Mhm.
And because she was so young, and there was I mean, I witnessed it when I was around like 12 to 13 years old, and I ended up helping her like recover from that. My dad also had a brain tumor due to NSAID use, which are like ibuprofen. So there was definitely certain things throughout my life that has kind of changed the way I look. My mom was on four different drugs after her heart attack, and she ended up getting off all of them naturally, and she ended up seeing like a holistic pharmacist,
Mhm.
and who tried to slowly do swaps for her drugs with supplements. And then I watched my mom like recover and get off a lot of meds. So there's definitely so many things that happened throughout my life. But when I did get to college, I realized, okay, nutrition, diet, all of these things they definitely have an effect. I realized when I started weightlifting and I started running, I also started running outside. And I was a crazy person. I would run in like cold weather in like shorts and a tank top because I was like, this is a mental game. I don't know why I did that, but it was like I wanted to like strengthen my mental health and everything like that. I didn't really drink too much in high school, so I definitely think that helped.
Mhm.
And I started to look at my body a little differently. And in that process, I was like, okay, I definitely want to go to school for nutrition because I do think food is medicine. But
Mhm.
while I went to school, I went to Penn State to study nutritional science. I realized that big food and big pharma were implemented into the curriculum. And
Yeah,
During that,
I
yeah.
feel like there's an overlap there that people don't realize is there. And I was going to ask you about that at one point, but also it just seems like you got interested because a lot of health issues and a lot of like seeing health issues around you and not understanding how it wasn't being addressed,
Yeah.
which is interesting. And I also, I mean, again, I feel like what we're deeply interested in,
Hmm.
um, it's not like we choose it, it kind of chooses us, which is weird.
Exactly.
And
Yeah.
so you can't help what you're compelled towards, but you
No.
can, but yeah, so I want you to continue because I do
Yeah.
feel like the nutritional sciences in school are captured by, funding from big pharma and
Mhm.
big food. And
Exactly.
yeah, if you can elaborate on that, I'd be interested to hear.
Yeah. Well, while I was actually in nutritional science degree, I really started to lose faith in that industry. I
Mm,
actually lacked purpose during that time in my life. I was like, what's the point if we're just maintaining disease and we're not actually healing and reversing disease? I was going into school to become a registered dietitian. So after school, I would have to work in a clinical setting for 2 years in a hospital.
mm,
And I was just questioning my future. I was questioning, okay, say I do become a registered dietitian, is the food industry going to control me? Is the pharmaceutical industry going to control me? Because I've heard, and a lot of registered dietitians have come forward about this and have talked about how when they are in the clinical setting, they don't really get to choose the dietary plan. They have like a booklet that
mm,
they're provided that gives them like recommendations, and they have to pick from those in a hospital
mm,
setting. So I knew, I was like, I do not want to work in the clinical setting. I knew I didn't want to work in a hospital because I watched a lot of family members go in and out of hospitals and literally get nowhere. And to me, the hospitals where people die. And
mm,
that was my association with hospitals. So and so I knew that if I was to become a registered dietitian, I would have to I was going to be controlled. And I
mm,
knew that you can go private practice and work for like specialist doctors or go your own route. But I didn't really think about it at that time. And it just made me question my future and if I actually could have an impact.
mm,
So I started to lack a lot of purpose and I started to become extremely depressed during that time because I was like, what's the point? I have
mm.
zero hope for this world,
This industry.
this
What
industry.
do
I
you,
think I was really young at the time too. I didn't really think large picture. And I was,
mm.
you know,
What
what
do
were
you
your
think? What's the influence of like big pharma in this like dietary model? Do you think they just fit this medical model, or do you feel like even the suggestions and those things are completely outdated, or they're funded by
yeah.
a
Well,
specific industry?
yeah. I I think when it comes to all health industries, even naturopathic medicine, there's nutraceutical companies are embedded into naturopathic medicine. And
Mm,
as a naturopathic doctor, I still had to learn pharmacology to become a licensed physician. It's just like part of the process. I
mm,
do think I do think there's a place for modern medicine when people really aren't willing to almost do dietary changes or lifestyle changes, or they're in a really, really chronic state and you kind of have to like start
save
with
them.
meds and then kind of, change their lifestyle and things like that. Um, but what I've noticed when I was in school is that we would learn, okay, someone has diabetes, they're on insulin, they're on metformin. How do we support them? Not,
Mm,
okay, how do we get them off the insulin and the metformin? These are drugs that help with diabetes and blood
mm,
sugar. Um, so it was more of just like maintaining and not actually healing.
mm,
And I was like, wait, you're telling me that pretty much you learn in school that you can't heal diabetes, that it is something that is not dietarily related, it's genetic. You hear a lot of genetics, and I do think there's a genetic component to a lot of different things. But there are some diseases that we know are caused by lifestyle and diet and stress and things like that. So I think it really I think it really depends.
Do you
But yeah.
think what
Yeah.
what what sort of illnesses or even like mental conditions, if
Hmm.
there's any specific or if there's just a lot, but what do you think is more we're told is like treated like with pharma or with in this medical model that we actually can heal from? Do you feel like a lot of illnesses are like are
Yeah.
okay.
So, okay, so this is an interesting topic because my whole form of medicine is we believe that the human body can heal itself. I do want to note that there is genetic disorders we have never seen before
Hmm.
because our environment is so toxic. We are seeing genetic disorders come out like never before, and it is quite frightening.
Hmm.
Um, I do think there are certain things that we can't typically heal.
Hmm.
But most diseases, unless it isn't a genetic issue where your body specifically doesn't can't make a protein, it literally physically can't make a protein like a collagen, where there's people who literally can't make a type of collagen, so they have a lot of issues with their arteries, their skin, and we can obviously maintain and help them,
Hmm.
but there there are things that we just can't control just because of genetic mutations. But I do believe that most chronic illness, most autoimmune, chronic fatigue, fibromyalgia, gut issues, a lot of mental health conditions like ADHD, like anxiety, like depression, 100% can be healed naturally. That's just what I believe in because it's just what I've seen and
Hmm.
just from my experience with my own health and also family members and clients as well.
Hmm.
Yeah.
Yeah, I mean, I feel like we don't give ourselves enough power. So we give too much power to other people or to medications. And we're
Yeah.
told, I do think there's a form of brainwash because I feel like we're told that
Hmm.
like you need to trust this model. And it's,
Yeah.
and when I was younger, I almost like felt like, well, who am I to question this? But then you realize that that's actually one of the forms of manipulation is like, you're no one and we're the power structure. And so what to here's what you're supposed to believe and what you're supposed to think, and if you question it then you're stupid or you're insane. But
Exactly. And
wi-
that's
like
that's the goal.
exactly, but someone like even
Yeah.
like Wim Hof, like the breathwork, the
Mhm.
Iceman, the breathwork guy, like he's
Love
so
Wim Hof. Yeah.
yeah, so powerful. And because I believe in, first of all addressing
Yeah.
your well-being but also addressing your psyche and your
Yeah.
stress and your
Hmm.
spirit.
Hmm.
But what sort of like steps do you think? I'm sure you deal with this with people who
Yeah.
have no idea where to even start. What steps would you give someone, at least nutritionally or lifestyle, to like just get a fucking like jumping point on their taking some control over their health?
Yeah. So I definitely think it really depends on the person when it comes to like the specific starting point, but obviously there is the basics.
Hmm.
Um, right now I would say we live in an extremely toxic environment. And the thing is, I don't want to scare people. I I just want people to have that knowledge that you really do need to clean up your environment as best you can. Obviously, there's things that we cannot control. Like we can't
Hmm.
control the outdoor air. Um we can't really control if we have an occupation where we are around toxins occasionally, if we need to make money. Also being in low populated areas, poverty, these are things that definitely people are often more exposed to toxins.
Hmm.
So it really is cleaning up the environment the best way you can. And that can be through diet, that can be through adding a water filter to your shower or putting a reverse osmosis on your sink. Literally simple things like that can really prevent like cancer and autoimmune disease. For me, I personally had an extremely high toxic load. I grew up climbing on leather. So my parents
Hmm.
own an upholster business and they sell leather. So I grew up climbing on upholster, and one thing that vinyl and leather is covered with is forever chemicals. So
Mm.
I was constantly climbing on these, constantly inhaling fumes. So there was definitely a lot of things throughout my childhood that definitely added to my toxic load. And it wasn't until I started cleaning up my environment, no artificial, like no fragrances, no artificial sweeteners, things like this, things that we can control, allows our body to start removing things that might be stored and affecting our mitochondrial function, which is our energy production and the ways our cells function. So, um, I always tell people first clean up your environment the best you possibly can. Then it's like optimizing diet.
Mm.
Optimizing, okay, adding in nutrient dense foods. I always tell people go back to your ancestors. So depending on where you're from, so I'm Irish as well as Sicilian. So I try to look, okay, what do those cultures typically eat? And that's what I try to implement into my diet.
Mm-hmm.
And then also I'm obsessing nutrient deficiencies. Like there's certain organ systems that will inform you that there's some nutritional deficiency, some labs that you can look at to determine, okay, this person might be low in zinc or magnesium. So it's just kind of like assessing them as a person and determining what nutrients they might not be getting from food. The one thing is our soil is extremely depleted. We just with the modern agricultural practices, we are just not getting enough nutrients and specifically minerals. And minerals are super, super important. So I clean up the environment, increase nutrient dense foods, really supporting minerals. I typically always supplement with a type of mineral supplement to make sure someone, because we are lacking it from our soil, it's lacking in our food source. So that is something that we need. And then trying to figure out, okay, exactly what we might need to remove from the body.
Mm-hmm.
And that that just comes with history. So,
You have a video on your Instagram about how toxic load can also cause nervous system
mhm.
dysregulation because the whole narrative right now is trauma,
Yeah.
and trauma does cause nervous system dysregulation, as
Yeah.
does many things. But
Yeah.
how I feel like no one talks about, again, environment or
Toxins. Yeah.
yeah, what, like, do you think it's is it so many things where it's chemicals in the household or in the air that are causing that, or some people certain things specifically?
I think it's an accumulation of chemical, emotional, and physical stressors. So I think
Mhm.
it's like a wide range. Typically, like I'll tell you my story for example. So I was around, my parents had a warehouse. I would climb in the warehouse. I was constantly around fumes. Then
Mhm.
I also was a heavy marijuana smoker for a little bit, which definitely non-organic, typically smoking neurotoxins, use a lot
Mhm.
of artificial things on my body. And when I did start having autoimmune symptoms such as muscle pain, joint pain, brain fog, all of these things, I I thought, okay, it's just because maybe it's just because of my diet. So I started focusing mostly on food. So I've
Mhm.
always been really into food, but when I started to realize that food wasn't, I tried every diet. I tried carnivore, um I tried carnivore, vegan, paleo, like I tried every single diet on keto, every diet, and I was still inflamed. Every food I would eat, I was still inflamed. And it was just because I pretty much just reached my toxic limit. So everyone has a different toxic limit, and
Mhm.
it could be emotional too. I do think I had a lot of emotions stored in my body that I did not deal with. And
Mhm.
there's a lot of things that I didn't grieve and I had a lot of guilt around. I definitely think emotions and your environment, like the people you surround yourself with, is crucial. And recognizing your triggers, recognizing your emotional triggers, recognizing your chemical triggers. I like when you do a lot of thorough histories, and you really assess someone, you can start to make those connections. Okay, was is it a chemical, emotional, or is it a physical stressor that is leading to their inflamed body?
Mhm.
Like some people will say, oh, if I go into a home, like if I go into my moldy home and grab something from it, because they're probably doing some remediation, removing some of that mold from the home, what you'll see is when they go back into the home, their body goes in a fight or flight in a sympathetic state. So sometimes it can be just the environment, not typically an emotional or trauma response.
Mm,
So
interesting.
yeah, so I do think it's an accumulation of all three. Um,
Mhm.
but it really wasn't until I started cleaning up the environment, detoxing my body, then did I realize that it wasn't the food. It was not the
Mhm.
food. I was sensitive to every food. You can name it, I had a reaction. And I was also sensitive to supplements too, where I would have a detox reaction. So it's more of just you have to work with the body very slowly because all of us have an accumulated load of emotions, chemicals, and physical stressors.
Yeah, addressing it comprehensively
Yep.
makes makes sense, but yeah, we do have people that are specialists, so which is important. If I have a broken hand or something, like I
Yeah.
might see a specialist, great, but
Yeah.
like they're not, there's many things that are comprehensive issues. The body works as a whole, and people don't think about that either. They think of it in separate parts because that's
Yeah.
how
That's how they're
um
taught. Yeah, I mean, especially specialists. When it comes to specialists, they're only looking at one system of the body. And that's the
mhm,
problem because everything works together. Everything.
mhm,
So it really frustrates me when I see because I see a lot of the clients that I do see are people who've gone through allopathic medicine, so they've gone to every specialist, and I'm kind of like their last resort, which really sucks for me because I kind of wish I saw them initially because they're on like now 5 to 7 drugs, sometimes
mhm,
more, depending on the person. And it's a specialist looks at that specific organ, looks at that specific symptom, might do imaging, and they'll be like, okay, you have this disease, and they give you for that disease, they give you that medication, and they have
mhm,
a specific protocol that they use and that they were given almost. So they're not
mhm,
thinking outside the box. They're not making those connections. There are specialists that do go the extra mile and do further investigation, but they're most of them are not looking at the whole person and the whole and all the systems together.
mhm.
That's definitely the issue.
I think I think addressing, and I know, you specialize in detox and
Yeah.
nutrition and stuff like that, but the emotional aspect of illness is still not looked at fully because a
Yeah.
lot of people have emotional issues, or they
Mhm.
have trauma, or they have this like deep-seated something with that's going on with them, and clearing that. Do you have techniques that you feel like were helpful for you to get like
Yeah.
through painful emotions or stress?
So I think everyone's different when you determine what kind of nervous system regulation techniques to use, depending on what type of personality type someone is. For me personally, meditation works for me. Meditation is
Mhm.
something that has been a practice of mine for the last like 4 to 5 years. And it has, I mean, obviously I got out of medical school, and when you're mostly sympathetic dominant when you're in medical school. I also went through a really, really hard breakup, and I experienced COVID. I got
Mhm.
knocked down by COVID where I had an autoimmune reaction just because my toxic load was too high. I healed
Mhm.
myself actually while I was in medical school. So, it wasn't until I actually dove deep into my emotions did I realize that that could be contributing to my autoimmune like symptoms.
Mhm.
For me, sitting in silence. I know that just would work for me. And in the beginning, it was definitely really, really painful to sit in silence. It was
Mhm.
my mind, things would come up, they would be uncomfortable, but I would literally sit with them and be like, okay, why did this come up? What do I need to learn from this experience? Why did this trauma event come up, and where is it stored in my body? And
Mhm.
almost just like breathing and going through that pain, we have to experience pain. One of the
Mhm.
issues is in today's society, I do feel like whenever anyone's experiencing grief or emotional distress, the first thing that they do is take an antidepressant or anti-anxiety med. But the thing
Mhm.
is, if you suppress those emotions and they never get dealt with, and then they get stored in different organ systems and different parts of the body. So for some clients who I know pretty much can't get out of their head, very restless. There's an Ayurvedic medicine, Vata type body type. So these are typically the thin framed, fast metabolism. These individuals typically can't sit and meditate. So for them, I am maybe doing some more movement, having them focusing
Mhm.
on their breath while they do some dance or swaying and or I don't know if you ever heard of Tai Chong. Um, wait, I think I'm saying that wrong.
Tai Chi or Qigong?
Yeah, Tai Chi. There we go. Yes,
Yeah.
Tai Chi. I will typically recommend that for like the more Vata-based people who have that fast metabolism, racing mind.
Mhm.
Just because their body's moving, or yoga is even great too, because you're not sitting there in silence and you're actually focusing on your breathing, focusing on your breath. And those are things that can definitely help people heal in the long run. It's a good starting point. But
Mhm.
I do also do think that there's a place for psychedelics and
Mhm.
ketamine and things like that for emotional distress for people with PTSD. Um,
Yeah, my
yeah.
my friend my friend and I are going to talk about that um when we do a podcast, but he has had a number of podcasts with other people regarding that, cuz I mean, I feel that the issue and the
Hmm.
thing about psychedelics is that it's also becoming a pain management thing. So now people want to reach for, instead of sitting with their pain like you're
Yeah.
saying,
Oh yeah,
and
you have to be careful with every substance. I always tell
yeah,
people,
and
yeah.
there's a place for psychedelics, and I also think that they have they're extremely powerful, so they
Mhm.
also have a place
Yeah.
in in people's lives
Yeah.
potentially, but also just reaching for it as, because it's being lumped into the medical system now too, where you have to use it for pain management. You can't just use it because you're a free thinking adult
Yeah.
that wants to explore something different, which would be a different narrative. Now it has to be about, well, I'm depressed, so I need ketamine,
Yeah.
which could be problematic.
I
In addition,
I agree with that. But the thing is, when it comes to psychedelics and ketamine and any type of, there's also LSD that's being used. The most important thing is to also assess that entire person and work on all different like fundamentals of health.
hmm
You can't just do psychedelics. Like you have to also focus
hmm
on diet, nutrition, lifestyle factors, and also try to regulate that nervous system in other ways because psychedelics can sometimes cause psychosis. They can sometimes like put someone in a bad headspace, and it can also lead to addictive and dependencies. So
hmm
I definitely think it could be really helpful for certain individuals. But you have to look at them as a whole and be doing a bunch of different things, not just one, you know? So,
hmm
um, I do think there's definitely a place for it. And I personally, I didn't really need psychedelics or anything to kind of get into that spiritual mindset or that state of nirvana, I guess.
hmm
And I'm very grateful for that. One of the practices that I use is actually fasting. Fasting
hmm
for me is spiritual. Um,
hmm
and I will do 3-day fasts, and usually on that third day, I will meditate for like 4 to 5 hours.
hmm
My body, like when your body is in a fasted state, your mind is so clear, especially on day three. And I can just let go, and I don't know where I go, but I go somewhere, and it's
what are some of the like the physical reasons to fast also, just to
yeah.
give people.
So when I started fasting, I started doing it for the immune system protection and resetting capacity because I was dealing with autoimmune. When I was dealing with autoimmune, like when my body was inflamed, I was just fed up with everything I was eating because anything I put into my body was causing a reaction. So this might have not been the healthiest, but I did start doing long-term fasting. I also did it throughout medical school, and I the thing about when you fast for there's obviously there's long term and then there's short term fasting. I'm typically doing long term. Long term is anything more than 3 days.
Mm,
So I use long term fasting to pretty much reset my immune system. If I feel like something might be coming on or I might be having an overactive immune response, the first thing I do is get into a fasted state as fast as I can, get into that ketosis state to get rid of any toxic debris or viruses that might be lingering or any cells. Like if you, many of us have dysfunctional cells. We have cells that are just sitting in our body, not doing anything. They're just flat, they're just hanging out and they're not producing energy, they're not being stimulated by our hormones to have any like effect in the body. And what happens is we're not like many people have issues with autophagy or they're constantly in a fasted state and they're never getting rid of those unwanted useless cells. So
mm,
fasting helps your body just it ramps up removal of just like cells that pretty much have no effect. And it also helps because you're not increasing, because you're not eating food, not a lot of nutrients and energy is being put toward your digestive system. Instead, it goes into the repair process. So you start getting
mm,
newer cells, newer gut lining, and it honestly it gets addictive. I'm not gonna lie. Or I like obviously I've done a lot of healing, but I still incorporate fasting even though I my autoimmune disease is in remission. I still incorporate fasting just because I feel incredible. Not
mm.
usually the first or the second day, but after the third day, I typically start to feel clear-headed and I definitely see some benefit.
And I've heard some different things about fasting with with women, like depending on like your place in the cycle.
Yep.
Does that matter?
Yes, it definitely does matter. I typically don't recommend fasting for any woman whose body's in a stress response. So if you are chronically stressed, sympathetic dominant, where your body's more in a fight or flight, so running after or a bear's running after you, more of that state where your body's not really digesting, it's not really producing what it needs. So for those individuals, I am 100% not recommending fasting until we can regulate your stress response a little bit more, and make sure all your hormones are happy. And then
Mm,
once you are in that state, you could definitely start incorporating fasting. I typically start with intermittent fasting, but I usually, for women, I have them do it instead of skipping breakfast, I have them skip not skip dinner, but eat a earlier dinner
mm,
so that their body has more time to have that autophagy experience. The thing is, your body goes into ketosis around 12 hours. So I
mm,
typically try to recommend 12 to 14 hours of fasting window. So typically I'll have someone stop eating around 3 or 5. And then when they first wake up in the morning, try to have some food just to regulate their stress because cortisol, our stress hormone, is typically the highest in the morning. So we definitely want to make sure that it's not too high or too low. And I definitely think fasting can affect that. And then it can also affect the hormone progesterone, which is kind of like our nurture growth hormone. It helps nurture the womb for it, prep it for birth. It also helps when we are when women are growing a child. Progesterone is the dominant hormone that
mm.
is pretty much helping to maintain the baby. So it is 100% crucial. So I typically, if I do also recommend long-term fasting, it's definitely during either during ovulation or during the menstrual cycle, because that's typically actually ovulation is when you start to have a dip in progesterone and I mean dip in estrogen and higher progesterone, and then during menstrual cycle that's when both of our hormones are low. So it doesn't matter; it won't affect pretty much the hormone
Got you.
production phase.
Is I feel like also there's a lot. This is a little bit different than fasting, but there's a lot of hormonal issues going on with people.
Mm-hmm.
Do you feel like environment for men, diet, and then birth control for women. What are you seeing
Yes.
most commonly?
Um,
A lot.
I would say the thing is, most people our age are on antidepressants,
Mm,
are on birth control, um, and are on a thyroid med. So typically, I think we have a lot of thyroid disease. That's what I suffered from myself, and I've been off meds since a sophomore in college. But I there's 100% it is environmental, and we know this for a fact that environment drugs, I consider drugs, pharmacological agents, to be a toxin. And not many
mm,
doctors believe this, but I do think because they affect nutrient utilization, they burn through so many different pathways in our body, and they do affect homeostasis. So they just affect how everything else functions in the body. So it's and every I would say most of the people that I see are coming to me with they're already on 3 meds, and
mm,
I'm talking about people in their 20s to 30s. So it starts to become really hard to determine if it really is a hormonal issue, or if it's a nutritional deficiency, or if it is just toxicity as well, or even
mm,
gut issues as well, because we know that the gut um, supports our brain function, and our brain function supports all it signals to all of our other hormones and organ tissue.
mm. What do you see like with do you feel like a lot of men are having hormone issues
Yeah.
or low testosterone?
Yeah.
What would cause low testosterone for a man outside of, and what would help a man increase his testosterone without just getting on TRT
Yeah.
or something?
So I think depending on the age, some men might need to go on TRT. I say usually men in their above 40s, at this point, like you might as well just go on some TRT. It probably won't hurt. It'll probably optimize your body. But for men below 40, who are really just they want to conceive, like they want to have kids, it is really important to optimize testosterone. But I think marijuana and alcohol are probably the number one and number two. And people
Mm,
don't realize is that most alcohol isn't organic. So you're getting pesticides, you're getting glyphosates. There also has been shown to be cadmium really high in some alcohols, which is a
mm,
toxic heavy metal that is very estrogenic. So
mm,
because it is estrogenic, and beer is also very estrogenic, so there's definitely different things, I think, lifestyle factors that are contributing to this. There hasn't been any research studies that show marijuana might lower testosterone, but clinically, this is what a lot of doctors in my industry are talking about. We are talking about how we are seeing with marijuana use that testosterone is lower in these individuals, but not just
mm,
testosterone. We definitely see there's testosterone works with other organ tissues like our brain. Traumatic brain injury is something that can affect testosterone levels, because it
mm,
affects signaling to the adrenals and parts of the body like this the I can't think of the name. Oh, the
mm.
just the testes. There we go. Signal to the
Got you.
testes. Yeah. So so no, I typically would say try to clean up the lifestyle factors. And typically I have seen that marijuana is a very addictive substances where some of my clients will not come off of it. So I have to
Mm,
kind of work with them on that and be like, "Hey, can we try to maybe switch to vaporized? Or can we switch to a higher CBD content? Or can we make sure it's organic?" So sometimes you have to really, really work with individuals. Um, but I think focusing on the toxicity, so what in their environment might be affecting it. We do think that there might be an EMF issue, so electric magnetic field might be affecting um, the testes and the sperm production. And
mm,
just because it does make we have there has been studies that show that it might produce more heat, and we do know
mm,
for the testes to function properly it needs to be lower temperature, and that's why when men go into the sauna, um there's the body's trying to cool itself off. So it is really important to determine the toxicities and where you can clean those up. optimizing diet, minerals specifically, making sure zinc, vitamin C, making sure the thyroid is functioning properly. I love iodine. I typically make sure someone is on iodine, or I evaluate their iodine levels to determine that might be a deficiency affecting their thyroid function, which will therefore affect their testosterone. So, um,
Mm-hmm.
yeah.
Is for like let's say a dude wasn't getting tested for anything like at the moment, and
Mhm.
he just like, do you feel like just avoiding drinking too much, avoiding smoking too much, eating more? Do you think like eating less of what would be helpful, like processed
Yeah.
foods, or?
Yeah, I would say focus on protein.
Mm,
Focus on real foods as much as possible. The thing is, we need cholesterol. Cholesterol gets a bad rep, but we need cholesterol for all of our sex hormones. So
mm,
if a man's not eating enough cholesterol, he's not going to have enough. He's not going to have enough testosterone production. The other
mm,
thing is adipose tissue. So fat, specifically around the abdomen, is going to make someone more likely to take testosterone and convert it into estrogen. So
mm,
I think the sedentary lifestyle, making sure you're moving is the most crucial thing. And also muscle growth. We do know that men who specifically do a lot of weight training and uh, do a lot of squats have been shown to have higher testosterone. So muscle is definitely extremely protective. So I definitely think we have a lot of it's multifactorial. So some people are. I do think this generation is very. We're definitely very sedentary, where we sit for long periods of time. And the one thing, circulation is everything. The blood flow
mm.
to the whole body is really, really essential. So there's yeah, so that's definitely crucial.
Yeah, people don't like fucking move, and then they're like, "Oh, my back hurts." Like you've
Yeah.
been sitting at a computer for 6 hours and you drank 3 Celsiuses and you were wasted drunk last night. Like obviously you don't feel good.
Yeah.
So there's also sometimes I'm sure you see it a lot because but I mean your mind is very advanced and you know a lot of what's going on, but there's some people who literally they're just like
Yeah. It is
they're
most people, I mean, for me, it is mostly just education. As a naturopathic
mm,
doctor, all I'm doing is one of the naturopathic principles is doctor as teacher. And I would say that's my the number one practice, that number one rule that I pretty much utilize the most. And you're pretty much like explaining people to be more in tune with their bodies. You're teaching them about their body so that they can be more in tune and start to realize, oh, okay, when I do this, when I do eat fried food, or when I do drink, I have noticed that this gets worse, or this gets, so you're just making them more aware. And
mm,
that is number one, because once people become aware of how things might be affecting their health, they are more likely to make those changes.
mm,
So I think it's just people don't realize, like, oh, also most people who come to see me. So I started doing longevity consults in the beginning. And then I started
mm,
to realize that all the people who wanted to see me for longevity should be actually in my chronic illness package, because
mm,
all of their symptoms were so concerning that I'm like, oh, this is not longevity in any way. I can't, like these a longevity I consider people who ultimately are healthy and they just want to optimize. These were people who were not healthy and had many, many different symptoms that were slightly concerning, where I was like, okay, yeah, this longevity, I got rid of it completely because I started realizing most people are just not healthy. And they
mm.
think that they are. But when I start to make connections with different organ systems, I'm like, when I start assessing their symptom picture, I'm like, oh, this is not normal. But they think it's normal.
One thing now too, and this is a little bit of a segue, but like people are uh, back on like going towards pharmaceuticals, but people that are not healthy or overweight are going to Ozempic. I guess that's like the new
Yeah.
thing. What do you, I don't know a lot about Ozempic,
Yeah.
but what do you think could be negative about that?
So I do think that there's positives, because there's some individuals who have binge eating disorders, and or their body, there are people who do the right things and their body just can't lose weight. I do think that there's obviously something going on with their mitochondrial function, or their liver is kind of toxic and it can't really utilize fat for energy. So that's what I believe. But there are people who were like, Ozempic changed my life. It helped me start making the changes. So I do think when doctors are utilizing diet and lifestyle along with Ozempic, it can be really helpful and really almost just
A
quickly,
catalyst.
yeah, it could definitely increase the healing process. And Ozempic actually has been shown, it's a GLP-1 antagonist. Um, so it has been shown to help with activation of autophagy. And as you
Mm-hmm.
know, I love autophagy. That's when we're in ketosis and we're removing a lot of things. So some people need the thing is, we're in such an overstimulated world where so many people are looking for that quick dopamine, and that
Mm-hmm.
includes food. So some
Mm-hmm.
people, and to get them to stop eating so much, the GLP-1 antagonist, semaglutide, Ozempic, can help them get more into a fasted state, which can promote healing. So I might have, yeah, I definitely put out a video where I talked about some of the long-term effects. I do believe the thing is, when you are mobilizing fat really, really quickly, the thing is, fat is very protective. It insulates a lot of our toxins. It
Mm-hmm.
insulates forever chemicals. It helps prevent heavy metals from causing toxicity. It's an insulator, so it's very protective for people with high toxicity. But the thing is,
Mm-hmm.
I do think people need to clean up their environments, they need to clean up their diet, and then Ozempic might be helpful just to make the healing process go a little quicker. I personally would probably never use Ozempic, but I do think
Uh,
it has a place.
understood. Are
Yeah.
there side effects to it, or do you just think that?
So I worked at a clinic as a med student, and I worked at two different clinics, and they both used Ozempic. And the most common side effect I see is not like that I saw in clinic was nausea clinically. Obviously, we don't have enough long-term studies on it, so
Mm-hmm.
I think that it could contribute to a worsening of fatty liver, just because it's so much fat is being like broken down, and it all has to get processed through the lymphatic system, which is a detox process in our immune system, and then also has to get processed through the liver. So it could
Mm.
put additional strain on the body, but the thing is, Ozempic is very, very new, so we don't really know the long-term effects.
What's going to happen?
Yeah, we don't
Yeah,
really.
that's what I was concerned about.
Yeah.
But have you seen people with like COVID vax side effects, or
Mm-hmm.
I'm sure you've seen people, but also like what is being observed with, because
So,
everyone,
yeah.
and the thing was that was another thing too, where people were like made you feel like you're an idiot if you don't want to take this vaccine, but
Yeah. So I think COVID in itself is not like other viruses, where so I went to a conference about, I think it was about a year ago, little less than a year ago, in November of last year, and it was just on COVID and all the research that we have on post-COVID syndrome and long COVID. So these are people who are vaccinated and people who are not vaccinated. We know that this virus doesn't act like other viruses. So they did a study where they inoculated SARS-CoV-1, which is I think it's the Spanish flu. I think that's it was when COVID-1 first came out, and then I think it was around 2008. And then
the swine flu.
oh, was it the swine? It might have been the
I think
swine.
it was a swine.
Yeah, I
Yeah.
think I might be getting it confused. So they inoculated rats with both SARS-CoV-1 and SARS-CoV-2. And what they saw was that the COVID-1 only precipitated in the lungs, which means it only hung out in the lungs after they
Mm.
injected the rat. With SARS-CoV-2, so with COVID-19, we see that the virus is actually hanging out in like every tissue. So it's hanging out in the brain, it's hanging out in the heart, the blood vessels, the muscle tissue. And what I'm seeing clinically, just from COVID itself, it has initiated a lot of autoimmune diseases. There
Mm.
is a component between viral issue, like viruses we know are a trigger for autoimmunity, specifically a lot of the herpes viruses like EBV, CMV, HSV. And COVID has been shown to reactivate a lot of these other viruses, and then itself is like so overtaxing on the immune system.
Mm-hmm.
So COVID itself is a very, very unique, and it can cause a lot of structural damage. And we don't know if there's a genetic component where people are more sensitive to COVID or sensitive to certain like the protein to COVID. And I do want to note, when it comes to the vaccine, I am definitely against the vaccine. Um,
Mm-hmm.
I'm against all vaccines, so I'm very anti-vax. So let's just throw
Mm-hmm.
that out there. Um, but when it comes to the vaccine, it's not really like other vaccines because it is an mRNA vaccine, which means it's like more like a gene therapy. And
Mm-hmm.
typically what I am seeing, because I would say maybe 85% of my clients that I see are vaccinated, and many people in my industry do not know what to do with this population, and I myself am struggling to treat this individual because things that I typically we know would be effective for people dealing with autoimmune disease or neurological symptoms are just not working. They're just not working. So a lot of us are coming together and we're trying to get really creative and trying to figure out how do we get rid of this. It's called spikeopathy, where the spike protein is proliferating so much, and it's causing blood clotting, and it's getting stored in different parts of the body, causing an immune response. And these individuals' immune system is already going haywire, probably
Mm-hmm.
beforehand, and this is kind of just leading to more issues. So
Mm-hmm.
I'm definitely we're making some progress. I have a mentor that I work with, and we converse about like what to do with some of these people. And it honestly, I'm so frustrated and I'm really upset. And there are days where I'm like, am I like I honestly, this is why I hate the government. This is it. Like this is, I think they're an evil entity.
Mm-hmm.
So I will never trust a I will never trust a pharmaceutical company. And I am always going to question absolutely everything now because of this vaccine.
Mm-hmm.
Because I've also watched so many videos on YouTube trying to figure out how to detox people from the spikeopathy. How like we're using a lot of blood thinners known as nattokinase and lumbokinase. These are things to kind of thin the blood to help eat away at those microfilaments and just these tissues that are clotting. And um, many people we're kind of just like we're coming together and we're trying to figure it out, but a lot of us are having to use pharmacological agents to kind of support these individuals because a lot of our natural approaches are not working.
Mm-hmm.
So we know that this virus isn't a natural virus. We know it's not. We know it's created in a lab. So because of that, it doesn't. It
Acts
makes
differently.
it's really hard. Yeah, the thing is, other viruses and other things are much easier to treat naturopathically with herbals, botanicals, nutrients. But when something's like synthesized in a lab, the thing is we wouldn't see it in nature. So because we wouldn't see it in nature, we many of us don't really know how to work with it. And then the gene therapy also is something that is very, very new, and we don't typically understand it or the long-term effects. So it is really, really typical. There are people who are doing $10,000. There's a one therapy that we do know is really, really effective for people who have like ALS type symptoms, where pretty much their immune system is attacking their nervous system. And it's called IVIGE. No, sorry, IVIG. And it's just an
Mm-hmm.
immune globulins. But this therapy costs $10,000 and I mean, sorry, $100,000. So it's extremely expensive.
Shit.
It's sometimes the only thing that is working for individuals. Um,
Mm-hmm.
but yeah, we're trying to figure this out.
Yeah, it's interesting. It was the weirdest. I mean, we're living in the weirdest
Mm.
time altogether. There's a lot of benefits to being alive in this time, but
Yeah, a
again,
lot of
you've
benefits.
seen we're like pretty much the same age. You know, you've seen like
Yeah,
this the world change drastically, especially after COVID and what happened with the government and then what happened with the
yeah.
vaccines.
I also think
And
our prefrontal cortex is finally developing, and we're seeing the larger.
for sure. Do
Yeah.
you Is there any issues you've had in the desert compared to back in Jersey, or do you do better with this climate, like in Arizona?
I, I definitely think the sun is very protective,
Mm-hmm.
and mood boosting. I
Mm-hmm.
personally, I love my family and I love all my friends that are in Jersey, but the one thing is it's very fast paced and
Mm-hmm.
I do feel like a lot of like that culture is like work yourselves to death, like you work yourself to death. So
Mm-hmm.
living more on the West Coast, I've noticed it is more laid back. People seem happier. So mentally and physically, I feel a lot better here. I feel more relaxed and just more content overall.
Mm-hmm.
Um, Also, there's less likely to have mold exposure, which is really nice. Yeah.
Yeah, I agree. I do have a tendency to do a little better with the like the humid climate for
Yeah.
some reasons, but I feel the mood difference with
Yeah.
the sunshine.
Well,
Like
it
the
could be
sun is
your
huge.
it could be your constitution as well. Like you could be more on like
Mm-hmm.
heat sensitive or more damp or no, sorry, more dry. So if you are a more dry constitution, usually humid environments, warmer environments, are typically better. Yeah.
Mm-hmm. But yeah, the sunshine, what um I'm sure you recommend that to people, but
Yeah.
what do you feel like about light itself? So it's mood boosting, it sets your circadian rhythm.
I
What
think
else does?
Yeah, I think people don't realize most of us are light deficient. We are so light
Mm-hmm.
deficient. Um, and it's essential. It's essential for all living beings. Like every single plant, every single living being on Earth needs the sun. And I do think people are afraid of it. And it's sad. I think it's sad. And I do think it's because our bodies are so toxic so that when we are in the sun, oftentimes we have UV damage and we don't have enough antioxidant protection to support that damage. So, obviously, it is the best to have a clean body and mind before going into the sun and believing that the sun is healing. If you think
Mm-hmm.
that the sun is damaging and it's going to cause increase your risk for skin cancer, and then you put all these toxic ingredients on your skin and in your body, it's the sun might not be as protective as someone who takes care of themselves and believes that the sun is has a healing capacity. The
Mm-hmm.
sun itself, um, is I mean, so first thing in the morning and so during sunrise and sunset, we actually get exposed to red light. So, you see all these red light machines and the thing is I just tell people if we can't afford one of those because they are expensive, a lot of the high quality ones, the ones that are lower in EMFs. Um, Go outside if some people can't wake up early. So I always say go outside during sunset and just
Mm-hmm.
just immerse yourself outside, just for like 15 minutes a day. Like that is just something simply you can do. We do know that red light has supports the mitochondrial function, so it does support energy. Once you support the mitochondria, you promote healing. So, the other thing is obviously we their circadian rhythm today is messed up in many different people because of our phones. We are exposed to blue light, and blue light is definitely going to affect um, absolutely the signaling of melatonin and cortisol production. These are two things that regulate our circadian rhythm. First thing in our morning, our cortisol should be really, really high. And then throughout the day, the cortisol should dip. And then when it dips, um, typically that's when melatonin starts to get produced. And we do know we
Mm-hmm.
have issues with the pineal gland, calcification of the pineal gland due to fluoride, chloride, the classics. And so it really, some people do need to supplement with melatonin. And it is, the thing is, melatonin is a antioxidant. So it's very protective. It's protective for the brain. And when we
Mm-hmm.
don't have enough melatonin, we don't have that deep restorative sleep. So it is really assessing someone's sleep, assessing how they feel first thing in the morning. How do they feel before they go to bed? Do they feel antsy, more energized? That will tell you typically that their circadian rhythm is off, and that they might need support and more light. The other thing about the sun is that it actually increases nitric oxide production. So when people are immersed in the sun, they you'll see like blotching of the skin. That's actually your blood vessels dilating. So
Mm-hmm.
This helps support circulation. So the sun, the thing about circulation, if you have cold hands and cold feet and hair loss and thyroid dysfunction and cold intolerance, this is a sign that your body doesn't have good circulation. Like things are
Hmm.
not going where it needs to go. And when we have stagnant blood, that's when we have disease. So it really is, sometimes with people, I'm just working on circulation just to promote
Hmm.
detox and the removal of things from the body.
Yeah, I feel like stagnation is a huge issue. I mean, you can just symbolically
Mhm.
visualize it with like going to a creek or a river and like where water's flowing, everything's like fresh and clean, and then
Yeah.
where things get stagnant, it's, you know, just
That's
gotta
where things
keep
grow.
on.
That's where things
Y-
grow, which people don't realize that. That's where you get the biofilms. That's where you get the parasites, the heavy metals. They get stored in these congested areas of the body. So
mm,
it really is all about, I mean, obviously there's so many different detox pathways, but the blood and the circulation is one of them.
mm.
Yeah.
Well, you said something about if you think the sun is bad for you and then you put all the sunscreen on, like, yeah, it's not going to be as good for you. I do think that way with the power of belief. Again, like we talked about Wim
Yep.
Hof
Yep.
earlier, because I can't, yeah, if I like go and I don't know if I'm thinking toxic thoughts and then I also am scared of everything, then I feel like it's going to affect me negatively.
100%. And I think when I first learned about all of the environmental toxins, so second year of medical school, I that's when we took environmental medicine. And I was introduced to all these things in our environment, and I was like, what the hell? I didn't even recognize that all these things could be contributing to a lot of my health issues. And I became very orthorexic. I started to become like crazy almost about my environment, and I realized that in itself is probably more toxic than the toxins.
Hmm.
Like
It is,
your
yeah.
mindset, if you believe that an environment is going to make you sick, or if you believe a certain food is going to cause a reaction, your body is already tensed up. It's already in that sympathetic dominant state. Your body is going to have some form of reaction to it.
Hmm.
So I deal with a lot of this with chronic illness because typically people are so traumatized from like the modern medicine field, and they've seen all these specialists and they don't trust doctors and they don't trust anything that you give them. Even as a naturopathic doctor, I have to do a lot of convincing, specifically with my chronically ill clients who are sensitive to the world. I have to make them feel safe. And a
Hmm.
lot of them, I have to like change the way that they think. And that's a process and that takes time. But the way that if you think something's going to cause harm and you think something's going to cause a reaction, no matter what, your body is going to have some type of either a minor or maybe an acute or a chronic response. So it really definitely,
Hmm.
the mind is extremely powerful. And yeah.
Yeah, no, I agree. And I think that too much being too controlling over over your environment isn't going to solve much. Of course you want to be aware, but you don't want to obsess. And then yeah, I don't know. I think that
Yeah,
it makes a
in the
huge
beginning, I
difference.
think everyone, when you learn about all these things and you become awakened, that's why I say you become awakened of maybe of all these things that might be causing harm. It definitely can be slightly stressful, but I tell people there's things you just can't control, and that's just a
Hmm.
part of life. So,
We're also resilient beings. Like we've come from
yeah.
such hard circumstances, and we now have the opportunity to regulate certain things.
Yeah, the
So,
thing is, to an extent, yes. So I do
mm,
think obviously there's natural toxins from our environment. There's things that are produced from bacteria and like mold, fungus, things like that. But then we have chemical toxins. So these are synthetic things that are created by humans. And
mm,
what happens is that these synthetic toxins, our body doesn't really know what to do with them. And
mm,
this is why we have so much pathology today, is because our bodies literally do not know how to detoxify them, specifically forever chemicals like PFAs. These are things that typically don't leave the body. So I think as humans, we need to realize that we need to stop producing these synthetic things. The farther we get away from nature, the more we start using these chemical agents, the more we move into cities, the sicker we become. Like we need to
mm,
be immersed in nature because we lose touch. with when we lose touch with nature, we lose touch with our health. And
Mm-hmm.
like nature is extremely healing. And we, again, just like how everything works harmonious in the body, we work harmoniously with nature. We actually
Mm-hmm.
typically don't, but we should. um, but yeah, I definitely think as we're definitely we're moving way too far away from nature. We're moving into cities. We're using technology, and I think we need to actually like we're now AI is like an obsession, but I really think we need to get rid of AI and go almost backwards. I think we
Mm-hmm.
need to learn more of our intelligence as a human, and then maybe we can start utilizing these technologies in the right way. But we need
Mm-hmm.
to first strengthen our mind, our bodies, our spirit, and things like that because again, so many of us are sick mentally that when we do learn about all these things, our body is not resilient and it can't handle these stressors. And then we're in a fear state. And when we're in the fear state, that's when we get greedy. That's when we think, okay, it's me or the world. Like it's you against the world. And that's not how we need to come together as a whole. And until we really work on our intelligence as a human and move away from technology and more learning more about our human blueprint and like all the things that humans can do, that's and then work together and come together, that's when we can actually use these technologies for yeah, for good.
For good.
Yeah, for good.
Mm. Yeah, and before like we'll wrap it up soon, but
Yeah.
before we do that, like what I don't know, 'cause like what makes you like so passionate, or what do you think is the importance of being so passionate? Because I think
Yeah.
that that was what I recognize with you, and I'm sure you feel separate from other people sometimes because you're, and I don't know, because I know a lot of people who just they don't care that much about anything,
Yeah.
and I think that's harmful.
Yeah.
So I want you to just kind of like explain what you see, how you think, and then how like what it feels like a little bit to be ahead of the curve, because I think that in 10 years people are going to be thinking the way you do, but right now you're still in some of that isolated percentage
Yeah.
of people who, I don't know, just what's it feel like, and what does that mean to you to just care about what you care about?
Yeah. I I think I don't know why I the thing is like I don't understand how I got here sometimes. I do believe I'm extremely grateful to do what I love every day and to be passionate about something and have that curiosity. And I do think in society many of us are very lost because we lack purpose, we lack spirituality. We don't believe that there is anything after this. So what's the point of even trying to do something in this world and trying to make a
Mm-hmm.
difference? And I used to be there. So I used to be atheist. I used to lack purpose. And that's when I was my sickest. And that's when I was in that victim mentality where it was my parents' fault or the school system like the pharmaceutical industry has full control. Like there's nothing I can physically do. Like I was I was just playing the victim card. And I
Mm-hmm.
think with time I don't know what happened specifically. I don't know when I had this specific awakening where I started to think a little differently and I started to really I think I accumulated abundance in my life where now I have the capacity to give to others. So the thing is I was in the fear state. I
Mm-hmm.
and I think many of us are. And I think it takes time to really deal with our emotions. But sitting alone with myself and being an introvert probably helps too, because I just spend a lot of time alone. And I do think spending time alone has really helped me learn who I am as a person um and who I want to become. And I just want to be the best human possible. So, but the more that I accumulate and the more abundance I have in my life is the more that I can provide and give to others. And I think that in the fear state, your body can't really obtain anything. Like your body, you can't find purpose, you can't find creativity. So it's
Mm-hmm.
more of just, I do think there is an emotional healing that needs to occur. And also, the body's our vessel. So we need to clean up our vessel and give it what it deserves, and treat our bodies on how they should be treated. You have to think about it, like, what would you recommend to a family member? Like, what would you want your family member to do? That's what you should be doing with yourself. Um,
Mm.
so I definitely think it's a process, but I think it starts with the body. It starts with cleaning up the vessel and realizing that we all have a purpose. We just have to clear our mind and clear our emotions and get out of that fear state. And I think Joe Dispenza, his books and his videos really transformed me and really helped me and guide me into my full potential. Obviously, I still have so much growth, and there's
Mm.
no,
We all do.
yeah, we all, and nobody is perfect, and this is the human experience. So we have to, we're constantly learning.
Yeah, Joe
Yeah,
Dispenza's like getting into a feeling before you have the experience
yes,
is powerful stuff because then it doesn't even matter almost if you have the experience or not. You already have the feeling.
exactly.
My
Yeah.
my opinion.
Yeah, no,
But
I 100%. And the thing is, you have to trick the mind in the beginning, because
mm,
you totally have to trick the mind. There's so many times I've had negative thoughts because of past traumas, past relationships, past individuals who might have made me feel small. But then I
mm,
realize it's not about them, it's about me, and it's about how I perceive myself. Because
mm,
yeah, I think obviously we need to heal those emotional traumas, and we need to sit with ourselves and realize what emotions come up during that. I also think we have so many distractions. We have so
mm,
many things that are preventing us from actually being with ourselves. Anytime someone gets uncomfortable, the first thing that they do is they go for their phone. They
mm,
scroll on Instagram anytime they're uncomfortable. But instead of feeling that emotion, sitting with yourself, maybe crying, maybe releasing something on paper,
mm,
maybe even using like a voice note and just like talking out loud to yourself and just saying things, and determining what might be the underlining issue. Just like, just how I look at, like, okay, what is the root cause? What is the root cause to your triggers? What is the root cause to your emotional response? Um, you also have to clean, like I always tell people, you got to clean up your Instagram. You got to get rid of anything that makes you feel uneasy and unsettled in your body. Like, you also have to remove some family members from your life. Not like remove completely, but maybe just you see them occasionally, or you put more boundaries up. Like, it really is all about trying to change your environment, and then when you change your environment, you will change your mental state.
mm.
Yeah.
Beautiful.
Yeah.
Well, I agree with you
Mhm.
100%.
Yeah.
Um, well, I'll leave it at that.
Yeah.
It's been real. I do
Excellent.
appreciate this and I appreciate you joining me for the first podcast, so I'm still
Super.
navigating this.
Super. Yeah, I'm super happy that we did this. It was great.
Mm, appreciate
Grateful
you.
to you. Grateful.